Coming up on 9:18, welcome back to CTV Morning Live. Time for Ask the Expert. Scott Watson is here from Watson's Pharmacy and Wellness Center. We're going to talk men's health today. Talk about men's health. If you'd like to make a phone call and ask a question, there's the phone number, 613-789-6559, extension 2803. You can also email us questions, ottawa.morning@ctv.ca, or get on Facebook and ask a question there, CTV Ottawa Morning Live. Simple as that. Good morning, Scott. How are you?
Good morning, Kurt. I'm well. How are you?
I'm very good. Thank you very much. I feel healthy.
Good.
Today.
Good, yes.
And we're going to talk about men's health today with one thing in mind. It's Movember. And you see a lot of guys around sporting their moustaches and so on.
Isn't it wonderful?
Yeah, it is.
It's really
such a great cause, such a great thing to do.
Many people coming into the store, and I was talking to one gentleman yesterday with his colleagues. He was raising several $1,000s at work for prostate research. So it's a wonderful thing.
And that's one of the things we want to discuss this morning and get some input on. People have questions about it. It's fantastic. Right. Is prostate cancer and the awareness about it that Movember has brought with it, right?
No, it's a wonderful thing, and I know that I was even talking to some women, and they were saying it's so good to see that people are talking about men's health, because they watch television, Oprah and Dr. Oz, and it's mainly women's health issues, but there is a lot to do with men's health. So I applaud the people that started the Movember issue.
There's a reason for it, is to draw attention to the things we should be doing as men, looking after ourselves, which is, I think, sometimes takes a back seat, doesn't it?
It does. It does. So, I mean, in terms of pharmacy and as a pharmacist, what I often think of when I see people, and I think we all have our own little stories. For me, it was a gentleman came into my pharmacy a couple of years ago, and he just said, Scott, I have a little bit of indigestion, a little bit of heartburn. And he was about my age, and, it just didn't really occur to me that there would be anything wrong. But he came back in a month, and he had said that he had had a heart attack. And so it just kind of triggered me. What can I do to help prevent that? And I think that's what this whole segment is about. And what can we do to help men's health? So I'm kind of thinking, I was talking to a doctor, and we were talking about men 35 to 60 and what can they do. So I think the very first and most important thing is finding a good doctor that you can work with.
Right.
So just
step number one.
Step number one.
Which isn't often, it's not an easy thing to do, but it's certainly doable.
And there's a lot of people that don't have that doctor. So make sure you take the time, invest some time, and find a doctor that you can work with.
Right. Simple as that. So that's step one.
People 40 to 50, maybe even 35 to 50, I want them to think about cardiovascular risk reductions. And your doctor can do tests to make sure that there's no problems there.
Right.
Also, the central obesity, your doctor is going to think about diabetes, type 2 diabetes. Now, that's what I brought these for, because at the pharmacy we can actually help in those types of screenings. We can look for blood pressure. You'll see blood pressure monitors in most pharmacies. I like these types of monitors, not the sit-down types. For some reason, I just trust these ones more.
Is that right?
They're recommended by the Canadian Hypertension Society.
Right. These actually test your blood pressure real quick.
That's right. It
doesn't take long.
And every pharmacy can do that, and we certainly take the time to try to do that with as many people as possible.
Right.
In addition, blood sugar testing. It's something that people should consider as well.
Right. And this is a
blood glucose monitor. It can tell you how your sugars are doing.
Now, is this just for people with diabetes?
No. This is, it is. That's what people with diabetes use, but it's also a screening device to see how people are doing with their blood sugars, and if it's...
Any idea how often we should have that done, Scott?
The doctors and the referencers are saying every 2 years you should check and see how your blood pressure is doing and how your blood sugars are doing.
Right, and that should be, if you in fact have a doctor and get a checkup done.
That's right.
An annual checkup, that should be part of the process.
That's right.
Right.
Down here, this progression, that's Mark, my friend the doctor, is saying, Scott, if this is what the central obesity and the blood sugar is all about, how we start off at 20 and somehow we just kind of end up with this central obesity, and that central obesity can contribute to something called insulin resistance, where our body doesn't use insulin as well as it should. That leads to increased insulin levels, and that can lead to a whole host of problems, which includes increased blood pressure, diabetes, increased lipids, so the bad cholesterol in our body, And that can lead to a whole host of cardiovascular issues like heart attack and stroke. So your doctor in the 40s and 50s, if he sees any sign of this, he might talk about lifestyle modifications, what kind of foods we eat, how much alcohol we're drinking, if we are a smoker, and try to make some modifications there.
Exactly. At some point, in many cases, this end result here is a result of lifestyle. So making modifications, changes to your lifestyle can only help you in that regard. And
I did bring this because
the GI diet. Yeah,
I'm such a big fan of this book. Everybody that I've recommended this to and everybody that I've seen read it, it can just help take off the pounds, and especially in that central obesity range. Well, not just, but that is one of the areas. Right. It's a very simple book. It just kind of classifies food as green, which is good.
Gotcha.
Yellow, cautious, red, which is bad.
The colors actually mean something.
And it actually, it's very quite simple. If you can just load up on the green foods, you can lose a lot of weight. I
want to talk more about men's health and some of the issues that men encounter. We'll take a break. We'll do that, but the floor is open to questions.
That's
all
right.
Maybe, and fellas, don't be afraid to ask those questions, all right? 613-789-6559, extension 2803 is the telephone number. You can email us, ottawa.morning@ctv.ca, or Facebook questions at CTV Ottawa Morning Live. Simple as that. Ask a question. You'll get the answer with Scott Watson from Watson's Pharmacy and Wellness Center on Ask the Expert. We'll be right back.